We just heard from Christine and Jillian, two very brave women who've had tough battles with breast cancer, but they've come out on top.
Joining us now to give us the very latest on breast cancer prevention and treatment is oncoplastic breast surgeon and functional medicine physician, Dr. Jenn Simmons.
Welcome,
Hi.
Dr. Jenn.
Thank you.
Good to see you.
Yeah.
Well, you know, as we mentioned before, about 1 in 8 women in this country will be diagnosed eventually with breast cancer, which is a scary number. What are the latest advances in treatment and detection for people at home who are watching right now?
Yeah, so I think the really exciting things that are happening in terms of detection are early diagnosis. So our screening modalities just keep getting better and better. They're more and more sensitive, and we can pick up cancers at the very earliest of stages. We can see 3-millimeter cancers, and maybe mammogram alone had that technology, but not in a dense-breasted woman. And now we add in digital breast tomosynthesis and molecular breast imaging, and it really changes that landscape because they're far more sensitive in that dense-breasted population, which in general, it's not always synonymous, but most of the time we're talking about younger women. And those are the people that we really want to capture those very early cancers in. In terms of treatment, we now are in the age of molecular profiling. So even as much as 10 years ago or 15 years ago, we decided that women who had a tumor greater than 1 centimeter would just automatically get chemotherapy. Or if they had nodal disease, they automatically got chemotherapy. And so a lot of women were getting chemotherapy. 70 to 80% of the women that were getting chemotherapy were having no benefit from it.
Really?
So all risk, no benefit. And now we have molecular profiling of these tumors, so we can know who benefits from chemotherapy, and we can also know what chemotherapy they benefit from. So we have targeted drugs against targeted molecules, and it's really changed the landscape. It's not only saved women from the side effects of chemotherapy with no benefit, but it's also giving us tremendous results in these women who are getting the drug because the drug is appropriate for them.
What does the BRCA gene mean? What does it mean if you have it? Like, why is that so important for, you know, some of us to be tested for?
So we all have the BRCA gene. The importance or the significance is who has a mutation in that gene, whose gene isn't functioning correctly. Because what the BRCA gene does is it prevents us from developing breast cancer. It corrects those breast cancer cells that develop are supposed to get recognized and destroyed, but in people with a gene mutation, they don't have the ability to do that. So they get cancers at very young ages. Now, that said, in that population, we're talking about a small number of breast cancer patients because the mutation population is really only 5 to 10% of the entire population of people who get breast cancer. So it's a small percentage that we're talking about. And in that group of people, the occurrence rate of breast cancer is around 87% over their lifetime. But it's not 100. And that's the interesting thing, is what else is going on there? There must be other influencers. So what I talk about is the study of epigenetics, or the things that we can do to influence our genes, to decide if those genes get turned on or they don't get turned on at all. So the things that we can do to influence whether or not we get cancer.
Right, so which actually brings us right to prevention, right? Because that's what people want to know at home. They're saying, okay, well, what can I do today to help prevent breast cancer?
In this traditional medical society, the things that we talk about for prevention are drugs which will decrease the likelihood that you get breast cancer. So a drug like tamoxifen, which affects the estrogen receptor on the breast cells. So that will decrease the likelihood that you will develop an estrogen positive or an estrogen sensitive cancer by about 50%. And then we talk about things like removing the breast prophylactically or preventatively, or removing the ovaries. So that's the traditional hat. I'm going to take off that traditional hat and put on my functional medicine hat, because there are things that every one of us can do today that will affect our health going forward, and not only prevent cancer, but prevent all the illnesses that plague our society. So, and those things are eating a whole food, plant-rich diet. They are getting daily movement, and it's something that has to make you happy. It's sleeping 8 hours every night. It is having a mindfulness practice, a mind-body connection. It's detoxifying your environment, so getting rid of all those chemical exposures that wreak havoc on our health. And the most important thing is our connection to one another, living a purpose-filled life that fills you with joy, because cancer doesn't grow in a joyful environment.
Here's what's frustrating to people. You take Jillian's story. She's 24 years old. If Jillian didn't notice the lump, she might have been in a more advanced stage.
That's exactly
so,
right.
I get that we can't do a mammogram on everybody, right, starting at age 21, but where do we stand now with the mandates, and what's the best thing? How should women approach this? Because it's still confusing to a lot of people.
It is.
Yeah, it's
and
very confusing to me.
Sure.
I'm just going to put it
Well,
out
it changes
there.
all the time.
Yeah.
It makes
It
sense.
does, and you have to remember who you're getting that information from. So
Okay.
in general, what I use is, if you are the average person of average risk, first screen at 40, and then 40 on yearly for as long as you enjoy good health. If you have had an individual in your family diagnosed before the age of 40, then your start of mammograms is 10 years before your relative was diagnosed. Now, that wouldn't have helped you. And so I also say, we need to be our own advocates. I heard you say that. I agree completely. And we need to know ourselves, know our body, know what feels right and know what feels wrong. And when it feels wrong, you have to stand true to that. And
Absolutely.
if your doctor says, no, don't worry about it, go find a new
Right.
doctor. Go
That's
find the next
exactly.
doctor.
You know what? I'm so glad to hear you say that, because
important.
I just went to the doctor. You know, I had an abnormal, and you know, I stay on top of it because of my mom. And they actually said to me on the phone, it hasn't been a year. I'm in the process of talking to my insurance company, but even if they say we're not going
Yeah.
to cover it, I'm still going to do it, because I just want to know that I'm taking care of myself. So that's what, you know, that
Be
really
your
is
own
what it's,
advocate.
you have to be your own
Yeah.
advocate.
You do.
So thank you so much, Dr. Jenn, for being here with us today. I mean, I feel that this information is just tremendously invaluable. So thank you so much. And I love that you're passionate about
Yeah.
it.
Thank you.
Please remember, ladies, all you ladies out there, get your annual mammogram. It could really, really save your life.
There's more Dr. and Diva coming up right after this.